America This Week, United We Stand. As the coronavirus continues to plague the nation, could we see a vaccine by the end of the year?
So you're really talking about how do you get 60% of America vaccinated as rapidly as possible.
I talk one-on-one with Dr. Deborah Birx with the White House Coronavirus Task Force, plus my discussion with our panel of medical experts.
Data does exist in other countries. It sort of showed that the schools are probably not the real source of spreading or super spreading, number one.
You have people who have real gravitas in Washington and have real experience, and you're not learning on the job.
And University of Maryland lecturer Jason Nichols is also here. All that and more right now in America This Week, United We Stand. Welcome to America This Week, United We Stand. We're in the final stretch of 2020 as Americans prepare for the holidays during a pandemic. There is some good news. Both Pfizer and Moderna are seeking emergency approval by the FDA and hope to start distributing their vaccines by the end of the year. Joining me now is White House Coronavirus Task Force Response Coordinator, Dr. Deborah Birx. Great person to have. Doctor, thank you for joining us. I see you wearing your mask. Very important. Doctor, tell us, I think Dr. Stephen Hahn, the administrator of the FDA, was called to the White House to be questioned as to the timing. Can we push some of these approvals quicker, and where are we? Give us a most up-to-date timeline, if you will, on getting these vaccines to the general population.
Great. Well, great to be with you again. And I think you can see what the FDA is doing is really analyzing the data to look for protection in all age groups, races, ethnicity, as well as I think they're looking very carefully to see if there's any partial efficacy after that first vaccination. That kind of information is really critical. Be critical for the ACIP decision making when they make their final decision. I know they are going to provide interim guidance to the CDC, but as they make that final decision, knowing if the vaccine has even partial protection after the first shot becomes critical. And so I think they're going through the data to really analyze and make sure that every American that is eligible receives the right vaccine, and that's why they're taking their time.
Dr. Birx, I think a lot of people were concerned about, okay, so the CDC makes a recommendation, the Coronavirus Task Force makes a recommendation, but it ultimately comes down to each individual state. Do you think the states should adopt the CDC recommendations of giving the vaccine first to frontline healthcare workers and then to the most vulnerable population, likely those over, 75, 80 years old?
I think each state has to look at their current circumstances, and that's why I talked about what does the vaccine do after the first shot? Because if there's partial protection after the first shot, then usually you don't go from 0 to 94, 95%. Usually there's some interim number, what we call point prevalence efficacy of 40, 50, or 60%. So I know that's being looked at, and that becomes very important for the states when they make those deliberations. Certainly, our frontline healthcare workers have been amazing, and I think you can see that our case fatality rates have been going down month after month because of the incredible care that they're providing. And we know that they become potentially exposed both in their communities and while caring for patients. So certainly we want to make sure that those who are working with COVID patients are protected. At the same time, states need to look at where are their vulnerable individuals? Are they in long-term care facilities, which we know they are, but are some of them in multi-generational households? And I think that's really going to be the question for each state, to really understand who's being hospitalized and who unfortunately is succumbing to this virus, and use that to help make decision on who should be prioritized after healthcare workers.
Dr. Birx, I'm a mathematician by trade. I spend a lot of time crunching numbers of all sorts. It took us somewhere around 8 weeks to go from 1 million cases to 2 million cases, and it only took us about a week to go from 12 million to 13 million, which means we are experiencing a geometric increase in cases, not deaths, but cases. My question is, with the vaccine coming out now, within a few months, we may have a certain percentage of the population vaccinated. Another percentage of the population will have antibodies. How soon can you guesstimate, are we at a situation where we could experience herd immunity as a country?
Well, thank you for bringing this up, because I want you really started out correctly. The surge that we're seeing now is deeper, involves more of the country, and has lasted longer. And that's how you end up getting into these geometric increases in cases, which are leading to increasing hospitalizations and will lead to increasing fatalities. And we know that that's the sequence of events. We know that we don't have a chance to get to herd immunity until we're at 50 or 60% of people with antibodies or vaccinating. We're probably not even close to 15% of the population having been infected. That leaves 80 to 85% of the population still vulnerable and at risk to this virus. And so then you're talking about how do we get 40% or 50% of that 85 million vaccinated. And we're not going to screen for antibody. We're going to vaccinate without pre-screening. So you're really talking about how do you get 60% of America vaccinated as rapidly as possible.
Okay, Doctor, about a minute or so, less than a minute, just any question in your mind when given that opportunity to have your arm stuck with a vaccine, are you going to go for it?
I have zero question. I've worked on vaccines and clinical immunology my lifetime. This was a straightforward vaccine for development. It's very similar to what we do with hepatitis B, and people have been vaccinated for years. We know what the critical antigen is. This is presenting an antigen in a unique way, but in the same way it's your body making that immune response to that particular protein. We know, and we know from the data of over 70,000 plus people immunized with this similar platform between Moderna and Pfizer, that it has no significant short-term side effects.
Yep. All right. Dr. Birx, always a pleasure having you on. Our show is better because of you, and the country's better because of you. Thank you for your service to the country.
Thank you.
Ahead on America This Week, United We Stand, 2 coronavirus vaccines could be available by the end of the month. But will there be enough for everyone right away? Next, we'll look into who could get them first. This newest coronavirus surge requires additional American resolve. Wear a mask, save lives, social distance, fight transmission, wash your hands, avoid the disease. Together, let's make the sacrifice to stop the spread of COVID-19.
Your neighbor needs you, each person, each time.
We stand America strong.
United we stand.
We stand America strong.
United we stand.
A coronavirus vaccine may be available by the end of the year, and we're one step closer to learning more about how it will be distributed and who will get it first. This week, a committee with the CDC voted to give the vaccine to frontline workers. Medical reporter Liz Bonus from our sister station, WKRC, has more.
The Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices met to discuss several things. One of the most topical, of course, the top priorities for COVID-19 vaccines. That means who gets the first doses and how they will be administered.
If Pfizer and Moderna stay in the data above 90% effectiveness, then it's incredible news, and we can put this entire pandemic in the past.
That, of course, the goal. But before we can put anything in the past, this CDC committee met for several hours today in Atlanta to vote on and consider the immediate future of the vaccine.
In order to be as thoughtful and as fast as we can and should be, the ACIP gives us criteria for everything.
The criteria expected to be established from this meeting includes vaccine distribution through 3 different phases. Phase 1A, healthcare workers and long-term care residents. Phase 1B, essential workers. And Phase 1C, adults with high-risk medical conditions and adults ages 65 and older. Ohio Public Health Advisor Dr. Stephen Fagans told me today, with limited amounts of vaccine, the main question being considered in today's hearing is this one. should healthcare personnel and residents of long-term care facilities be offered COVID-19 vaccines in Phase 1A. So there's been some discussion about whether or not it should go to the most vulnerable, perhaps nursing home residents and those who are immunocompromised, even before frontline workers. What is your take on that?
The staging has always been that those who are on the front lines are the first to be vaccinated in any type of pandemic, in part to preserve the capability to respond to the pandemic.
Dr. Fagan says vaccinating frontline workers for older adults is generally recommended before the residents, partly because
there are some things we may not know about the vaccine. Then we want to make sure that groups who get the vaccine, are relatively healthy at first.
And partly because if you look at how the virus spreads, vaccinating workers who are in the community will also protect the residents. Now, what's interesting is this committee meets several times a year, and they discuss a lot of different vaccines, rubella, shingles vaccine, all the ones you commonly hear about, these vaccines going through that same process. I'm medical reporter Liz Bonus. We'll throw it back to you.
Thanks, Liz and WKRC for that story. This week in an interview with ABC, Dr. Fauci said communities should work to keep children in schools during the pandemic. Take a listen.
Close the bars and keep the schools open is what we really say.
And his comments are sparking some debate as coronavirus cases rise nationwide. Now let's bring in our panel of experts to discuss emergency medical physician Dr. Todd Dorfman and the president and founder of Palmetto Clinical Research, Dr. Colby Grossman. Dr. Colby, Fauci says keep the schools open. Now he's been all over the place. I really want to talk to you a little bit about these vaccines. Give us a sense of how effective you think these things will be, and will there be any side effects?
Yeah, so great question. So I think that you have to understand one thing, and that is that this is the first time we've ever used a messenger RNA vaccine. So the mother of messenger RNA vaccine is Dr. Carrico, and she worked on it in 1990 and was unsuccessful. And it wasn't until Dr. Weissman at Penn kind of gave her a little Band-Aid that this kind of breakthrough happened. That spurred Dr. Rossi to form Moderna and Dr. Sahin to form BioNTech, which was then bought out by Pfizer. So we've never used a messenger RNA vaccine before, but it looks like we've done 40,000 patients, and so far the vaccine looks safe and effective, at least 90% for both the Pfizer and Moderna.
And Dr. Todd, you're on the front lines in the emergency room and whatnot. Are you concerned that, are you looking forward to taking this vaccine? Are you looking forward to getting that first jab? Are you concerned about it? Is there any pause at all for you being one of the first to getting it?
Well, not really. Honestly, I trust the FDA process and how the FDA is going about vetting the vaccine. I think that on the surface, what everyone sees in the press is only just a few percent of the data that's available, and it's being really well vetted. I'm also encouraged by the fact that the UK just approved it, and they have an analogous process to approving medicines and devices like the FDA. So I feel comfortable, and honestly, the benefit far outweighs the risk from what I can see right now.
Colby, you're going to have a lot of patients who are looking for this vaccine, yet at least one of the vaccines, it's got to be stored at 96 degrees below zero. That's quite a bit of onerous capability for you to be able to supply that, right?
Okay, so another really interesting question. So the Pfizer vaccine has to be stored at minus 70 degrees centigrade or minus 96 degrees Fahrenheit, but it can be shipped on dry ice. So the dry ice shipment would occur with changes of the dry ice every 5 days. So it doesn't have to be shipped in a minus 70 degree freezer. That would be almost impossible. So it can be shipped on dry ice, with the dry ice being changed every 5 days for a maximum of 15 days. Then that vaccine could be moved into a refrigeration unit, a refrigerator, for 5 days. The Moderna vaccine, on the other hand, is shelf safe at refrigerator temperature for 30 days and freezer safe until 6 months. So yes, I think the Pfizer is going to be a problem, but because we don't have minus 70-degree freezers all over the place. But if the dry ice technique is going to work, then I don't think it's going to be a problem. Every shipment will have a thermometer in it that will record the temperature, and if the thermometer drops below a certain degree, then it will be considered not useful.
Right. All right, let me ask Dr. Todd, your thoughts on Fauci saying close the bars, open the schools.
Well, data does exist in other countries from, several months ago, frankly, that sort of showed that the schools are probably not the real source of spreading or super spreading, number one. Number two, children are probably a bit less susceptible in terms of obviously fatality rates compared to an elderly individual who, has comorbidities or other medical problems. So the bottom line is, I think if you can appropriately social distance and keep those kids together and keep the kids maybe away from the nursing facilities and structure it a little bit differently, I do think you can open the schools. Right. Now, regarding the bars and restaurants, I think it's kind of a financial, question versus how much you want to invade with public health measures. I mean, the obvious thing is if you close down every single thing and never let anyone talk to each other and everyone wore masks everywhere, face shields, it'd be hard to spread the disease.
All right, we're going to have to leave it there. Again, I want to remind all our audience, that's Dr. Colby Grossman down in South Carolina, great doctor. Also another doctor, a good friend of mine as well, Todd Dorfman in Boulder, Colorado. Great having you gentlemen on this panel as always. Thank you, doctors.
Thank you very much. Pleasure to be here, Eric.
Coming up on America This Week, United We Stand. What message do Joe Biden's cabinet picks tell Americans and the world? Jason Nichols joins me to break it all down next. And Black Friday came and went, then Cyber Monday broke records for spending this year, but for many, a little-known day came next, Giving Tuesday. The hashtag doesn't trend and the media doesn't pay much attention to it, but Giving Tuesday is an important day. It's a day we give back. 2020 has been a rough year, no doubt, but I'd like you to consider giving back a little. The Eric Chase Foundation was set up to assist families struggling with opioids and families like mine who have lost a child, a brother, a sister, or other to a deadly opioid. We're fighting for our children's lives, and your help is vital. Go to ericchasefoundation.org if you can help us out. You'll be doing something very special, saving lives of our most important, precious commodity, our kids.
United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand American strong.
United we stand.
We stand American strong.
City by city, state by state, town by town, stand American great. Everyone stands American strong. When strength by one equals strength by all.
American values, American pride. Your neighbor needs you, each person, each time.
We stand American strong.
United we stand.
We stand American strong.
United we stand.
America This Week, America's fastest growing political show, points out how rough and tumble politics shape opinion in every region in our country. We tell American stories, stories that touch our people, determine our politics, focus on the future of America.
I'm Eric Bolling. Join me for a fascinating look at America This Week. This week, Joe Biden announced several key nominations and appointments for cabinet positions, communications teams, and economic teams. Joining me to discuss is University of Maryland lecturer Dr. Jason Nichols. Jason, very, very good to have you back. The one that struck me, and I think Kayleigh McEnany really had a problem with this, is that Joe Biden announced a all-female top-level communications team, which is great, fantastic, I get it. But Kayleigh McEnany points out they have the same thing. Meanwhile, Joe Biden is claiming it's the first time anyone has done that. And the media, by the way, the lapdog media just kind of wags its tail and agrees with whatever Biden says. The truth of the matter is all the top communication staff at the White House currently are female.
Yes, that is true. I would say it depends on how you define top-level communication staff, because there certainly are a lot of the deputies happen to be men. But at the same time, I think the important thing that the Biden administration is trying to get across is that not only are they women, it's diverse women. So you have women of color, which the Trump administration has zero. But at the same time, that these are people with experience. You have Bedingfield, who was, the comms director for the vice president in the previous administration. You have Psaki, who was now the press secretary or incoming press secretary, who was comms director under Obama. You have Simone Sanders. You have people who have real gravitas in Washington and have real experience, and you're not learning on the job, which is what we've seen a lot of times from the Trump administration. And at the same time, we know that this group is going to work with the press. They're not going to hide from the press. They're not going to call the press the enemy. And I think that's why they're probably getting some of this favorable coverage.
Well, they're getting favorable coverage, Jason, because the press, it leans very hard left, let's be honest with you. And I'm going back to President Obama. You go back president after president, the press leans left. Let's just talk about a little bit about what's going on since Biden has been president-elect. He's gotten questions like, what are you going to do for Thanksgiving? Hey, what do you think about Trump's tweet? Instead of asking hard-hitting questions of the president-elect, like, what's your answer to Antifa, violence in the streets? Or what is this mask mandate? Are you going to have a mask mandate? Because once you said you were going to nationally, and then you weren't going to, and then you were, you flipped back and forth. We haven't had those questions asked of this man. I get it's a honeymoon period, but Jason, when does the honeymoon period end, and when are the press going to step up and earn their cred and start asking tough questions of this guy and Harris?
Well, first of all, let me just say that I hope that the press, the Biden administration doesn't hide from America this week. It doesn't hide from Sinclair. It doesn't hide from you or any of the other.
They do, Jason. Jason, they do. They do.
Yeah,
they do. For a better part of a year, we tried to get anyone from the Biden camp to come on the show, whether it's Joe Biden, Kamala Harris, any representative, any senior staff, any staff. Not only that, they just completely ignored the request. So all this, it's going to be a real great relationship with the press is BS. It's going to be a great relationship with the left-leaning press who does nothing but throw them softballs and puff pillows as questions.
Yeah, well, I can tell you this. I don't recall Donald Trump doing any interviews on CNN. I don't recall him going on MSNBC. I don't recall him going in some of the left-leaning media. And that's understandable, particularly when you're running a campaign. I do remember, one of your old colleagues interviewing President Obama several times over at that other network. So there are times where I think you're going to see Joe Biden, who's not going to hide from the press, and he's certainly not going to antagonize them. And I hope that they will come on to your program and to others and to speak to that. And, the messaging won't be that Sinclair or other parts of the media are the enemy of the people. I think that was a really problematic message that I think the press got really tired of and started going after and not recognizing some of the accomplishments of the Trump administration. So I think the Biden administration will have learned from that, not to antagonize the press, even the right-wing media. There are some people we know that are not going to give this administration a chance under any circumstances. I know that you're certainly more open-minded, and I hope that they give you that opportunity.
Well, we'll try and we'll continue to ask, but my guess is My guess is we'll have an air ball for 2021 as well with anyone from the Biden or Kamala Harris camp. Jason, always good talking to you. And look, ask the tough questions. I have no problem with the Jim Acostas or the John Carls of ABC or Maggie Haberman with the New York Times giving President Trump a hard time because they ask the tough questions when he's president, holding truth to power. You have to do that. But let's be fair now. Now let's turn it around and do the same thing to a Democrat who's occupying 1,600. Jason Nichols, always good having you on.
Thank you.
Never miss an episode of America This Week, United We Stand. Just set your DVR, go to facebook.com/America Bowling, all one word, to find out when we air in your city. We have a complete list at the top of the page. Also, don't forget, subscribe to our YouTube channel so if you missed a show or want to rewatch an interview, you can see them all right there. This newest coronavirus surge requires additional American resolve. Wear a mask, save lives, social distance, fight transmission, wash your hands, avoid the disease. Together, let's make the sacrifice to stop the spread of COVID-19.
Your neighbor needs you, each person, each time.
We stand America strong.
United we stand.
We stand America strong.
United we stand.
This newest coronavirus surge requires additional American resolve. Wear a mask, save lives, social distance, fight transmission, wash your hands, avoid the disease. Together, let's make the sacrifice to stop the spread of COVID-19.
Your neighbor needs you, each person, each time.
We stand America strong.
United we stand.
We stand America strong.
United we stand.
Thanks again for joining me for another episode of America This Week, United We Stand. The holiday season is underway, and it's a great time to reflect on our blessings and give back where we can. We hope you can also connect with your families safely, of course. This week, First Lady Melania Trump unveiled the White House Christmas decorations, appropriately named America the Beautiful. We agree. Have a great night, everybody.
Sinclair Broadcast Group, connecting people with content everywhere.
Ahead on America This Week, United We Stand. As the coronavirus continues to plague the nation, could we see a vaccine by the end of the year?
So you're really talking about how do you get 60% of America vaccinated as rapidly as possible.
I talk one-on-one with Dr. Deborah Birx with the White House Coronavirus Task Force, plus my discussion with our panel of medical experts.
Data does exist in other countries. It sort of showed that the schools are probably not the real source of spreading or super spreading, number one.
You have people who have real gravitas in Washington and have real experience, and you're not learning on the job.
And University of Maryland lecturer Jason Nichols is also here. All that and more right now in America This Week, United We Stand. Welcome to America This Week, United We Stand. We're in the final stretch of 2020 as Americans prepare for the holidays during a pandemic. There is some good news. Both Pfizer and Moderna are seeking emergency approval by the FDA and hope to start distributing their vaccines by the end of the year. Joining me now is White House Coronavirus Task Force Response Coordinator, Dr. Deborah Birx. Great person to have. Doctor, thank you for joining us. I see you wearing your mask. Very important. Doctor, tell us, I think Dr. Stephen Hahn, the administrator of the FDA, was called to the White House to be questioned as to the timing. Can we push some of these approvals quicker, and where are we? Give us a most up-to-date timeline, if you will, on getting these vaccines to the general population.
Great. Well, great to be with you again. And I think you can see what the FDA is doing is really analyzing the data to look for protection in all age groups, races, ethnicity, as well as I think they're looking very carefully to see if there's any partial efficacy after that first vaccination. That kind of information is really critical, be critical for the ACIP decision making when they make their final decision. I know they are going to provide interim guidance to the CDC, but as they make that final decision, knowing if the vaccine has even partial protection after the first shot becomes critical. And so I think they're going through the data to really analyze and make sure that every American that is eligible receives the right vaccine, and that's why they're taking their time.
Dr. Birx, I think a lot of people were concerned about, okay, so the CDC makes a recommendation, the Coronavirus Task Force makes a recommendation, but it ultimately comes down to each individual state. Do you think the states should adopt the CDC recommendations of giving the vaccine first to frontline healthcare workers and then to the most vulnerable population, likely those over, 75, 80 years old?
I think each state has to look at their current circumstances, and that's why I talked about what does the vaccine do after the first shot. Because if there's partial protection after the first shot, then usually you don't go from 0 to 94, 95%. Usually there's some interim number, what we call point prevalence efficacy of 40, 50, or